we are going to discuss stroke today, and the reason why we chose the month of May, does anybody know? It's because it's Stroke Awareness Month, okay? So we want to make sure that you guys know what is a stroke and know how to prevent it, and most of all, if some of your friends are having a stroke, we know what to do, okay? So we're going to talk very simple today, knowing what is it, what are we going to do when somebody has a stroke, and what are the treatments available, because there have been very good developments for stroke in this year, okay? So the first thing that I want you to understand is a little bit of numbers about stroke, because basically it is a big deal in the United States. It is like 800,000 people would suffer stroke per year, which is a lot. And then if you think about it, every 40 seconds, let's count, a person would have a stroke. More than that, a person would die from the stroke every 4 minutes. So it's something that we have to be aware. It's something that happens in youngsters like you guys. So we have to understand that. And you have to know that it is something that can be preventable, okay? So it is the leading cause of adult disability in the US. So it is a condition that needs to be known and needs to be understood. And once we understand it, then we'll be able to serve you, okay? So you guys are not here for me to tell you that a person dies every 4 minutes of stroke, right? No. You guys are here because up to 80% of all strokes can be prevented, okay? So what we're doing here is to know how can we prevent, and if you have a stroke, to know what to do to try to prevent the disability, okay? If 80% can be prevented, I'm going to go back here. We're not doing a good job on telling you guys what to do with a stroke, okay? Or telling you guys how to prevent it, because if 800,000 people are having a stroke every year, that's a lot, okay? So let's talk about what is a stroke, because we say that word a lot, and maybe one or a few of you have had a stroke, but maybe you don't understand it. So what is a stroke? Stroke is like, do you know what is a heart attack? Do you know what is a heart attack? Yeah, most of you know what is a heart attack. Well, let's call stroke a brain attack. It is the same thing that happens in the heart. You have a clot in the heart that can produce a heart attack. You can have a clot in the brain that can produce a brain attack, okay? So a stroke, brain attack, whatever you want to call it, just know what it is, okay? It can happen to any of us at any time. It can happen to a little baby. It can happen of a baby inside the mother's womb. It can happen to a child. It can happen to a person like me or to a person like you. The problem is that after 55 years of age, the risk of stroke increases every year or every decade. So that's why we're doing this with you guys, because you have to be aware of it. So what happens with a stroke, as what happens with a heart attack, is when you don't have blood flow to a part of the brain, then that part of brain begins to die, all right? That doesn't happen like suddenly, that dies suddenly. That happens over a period of time. And the period of time could be minutes. So that's why we have to be very vigilant, all right? So when this happens, the brain cells don't have any oxygen. And then if they don't have any oxygen, let's try an exercise. Let's stop breathing for a second, okay? If you don't have any oxygen, then probably there's going to be death, okay? So there are different types of stroke, and we're going to talk about 3 basic things today. 3 basic things, and I would like you to repeat it, because guess what happens to people when they, after they eat? They fall asleep. And I don't want to see anybody sleeping, okay? Okay? So the 3 types of stroke are hemorrhagic. Can you say hemorrhagic? Okay, ischemic, And this is a long one, transient ischemic attack. And if you cannot pronounce that, you can say mini stroke, but that's, we're going to talk about that. So hemorrhagic means bleeding. So if there is a bleeding in the brain that usually is caused because of a blood vessel burst open, then that's hemorrhagic, okay? And that's a kind of stroke. Ischemic means like the heart attack, an infarct. There's a clot that cuts the supply of the blood in the brain, and then that's an infarct. And the transient ischemic attack is when you go to somebody goes to the emergency room and they have symptoms for 5 minutes, and then they don't have any symptoms anymore, and then they do a brain scan, and the brain scan is clear. They say like, oh, you probably had a mini stroke. Well, that is a transient ischemic attack. And if I'm going to talk, and if you're going to learn something today, I want you to learn about transient ischemic attack, okay? Because that is basically a stroke waiting to happen, all right? So do you want to prevent stroke after it happened or before it happens? Before. Okay, so if you have a transient ischemic attack, then we have to act, and we have to be fast. And I'm going to talk to you more about that, okay? So can you say again, hemorrhagic, ischemic, and transient ischemic attack? Yes?
Which test is best to prevent a stroke? Like, you have the ultrasound and that's...
Oh, we're going to talk a little bit about that. Just in 1 second, okay? But the best test in general is an MRI of the brain. If you cannot have an MRI of the brain, a CAT scan of the brain. Where can you get a CAT scan and an MRI? In the hospital. So the main thing is that if you have any symptoms of stroke, you go to the hospital. Oh, no, you're already sleeping. Come on, go to the hospital. Can you say it again? Okay, a little bit. Let me try to talk a little bit more to see if you guys wake up, okay? So this is a hemorrhagic stroke. It is when you have a vessel. This is a vessel here. I don't know if you guys all are seeing it, but there is a vessel and it bursts open. And it can be of many forms, but it does not matter. It's a burst vessel. And then that part of the brain that did not have oxygen, because this vessel, this part's cells get the oxygen in the brain. So if you don't have any oxygen, then that part is going to die. All right? So then yes, go ahead.
What is the difference between a hemorrhagic stroke and aneurysm?
Okay, so that's why I say that I wouldn't bore you on the types of hemorrhagic stroke, but a hemorrhagic stroke that is a burst vessel can occur because of aneurysm. So it can occur because of aneurysm, and the most common cause is high blood pressure, okay? So it can cause it can be because of high blood pressure, because of aneurysm, because of very thin blood vessels if a person smokes, or if a person has high cholesterol, also that can happen, okay? All right, so the ischemic stroke, that is a new word that you guys got today. The ischemic stroke can be of two parts, okay? It can be embolic or thrombotic. That's like too high level here for you, but I want to talk to you about that because embolic stroke comes from either the heart or the vessels outside of the brain. So it is a clot that travels, okay? So that's the only thing that you have to know about embolic. It is a clot that travels, and then it gets in the brain, and then cannot go anymore. So it lodges in that area of the brain, and then that part dies, okay? The most common cause of a traveling clot is something called atrial fibrillation. Does anybody know what is that? AFib, yes, yes, okay? So AFib is basically, if the heart goes like this, then AFib will go like this, and then the blood doesn't go anywhere. If the heart is pumping like this, right? The heart is pumping, but then it goes like this, the blood does not go anywhere. And if the blood stays in one place, everybody has caught, right? If the blood stays in one place, it's going to form a clot. Yes?
The arterial fibrillation, is that the same thing as palpitation?
Well, a palpitation is a symptom, so you can have palpitations. What he's saying is rapid heartbeats. So you can have rapid heartbeats if you have AFib, but that is something that you have to check with your doctor to see if you have it or not, okay? So a traveling clot, AFib, it can also be caused by problems in your vessels here in the carotids. And it can be caused by valve problems in the heart. That's why the heart and the brain are very important to be checked out, okay? All right, so then the other type of stroke is the stroke that happens inside of the brain. The clot is formed inside of the brain, okay? So we have two types of strokes that are ischemic, right? The one that is embolic, that is a traveling clot, and the one that is thrombotic, that is the one that forms inside of the brain. And that one is usually seen in people with high cholesterol and with high blood pressure, okay? And then the most important one that I told you about today was oh, you have not paying attention. No. Transient ischemic attack, okay? Transient ischemic attack. So half of the people who have a TIA, as we call it, TIA or mini stroke, will have an actual stroke. So 50%. So that's very serious. Okay? So nearly half of all strokes occur within a few days of a TIA. So if you have this tingling and numbness in your hand, and you have it there, and it happened for 15 minutes, and you say like, nah, whatever. And then it happens again for 15 minutes, and you say like, oh, I'm just gonna go and play golf, and not pay attention to it. In the next few days, you can potentially have a stroke. So that is why it is very important to pay attention to the transient ischemic attack, okay? The main thing is that it is almost the same as a stroke, but it goes away really fast. So the symptoms will go away within 24 hours, okay? So transient ischemic attack. So what do you have to do if you have a transient ischemic attack? Wow, you're getting it, okay? You're good. You have to go to the hospital, because if you have a transient ischemic attack, what could happen in the next few days? You could have, oh, okay, my job is done here, I'm gonna go, no. Okay, that's good, okay. So what are the symptoms of stroke? You have to tell me, because I cannot let you guys fall asleep. So what are the symptoms of stroke? Exactly, weakness in your face, what else?
Slur your speech.
Yeah, speech problems, what else?
And you can't lift your arms up.
Exactly, weakness in your arms, or it could be weakness in your legs. What else? Slur speech. Droopy face, okay. So you guys got it, okay? So if you have any sudden numbness or weakness, or I would say tingling in any part of your body, face, arm, leg, or all together, that's a symptom of stroke, okay? Any sudden confusion, if you're with your friends eating and suddenly the person says like, oh, let's go and jump in that pool there, or something like that. And like, oh no, hold on a second, there's something going on. So sudden confusion can also be part of this. Trouble speaking, and that could mean, I don't know what is the name of that store that we used to go and difficulty finding words, okay? Or it could be a slur speech, okay? Now, with the difficulty finding words, there's something that is natural that is called AGE. Age, okay? All right? That is natural. I'm talking about really bad difficulty finding words, okay? That occurs suddenly, all right? So what about if a person is having trouble walking? And this is a big one that people don't usually know. Dizziness. If a person has balance problems, if the person has what is called vertigo, okay? If the person has lightheadedness or dizziness or like, oh, I'm stumbling to the right or to the left, that is very important to go to the hospital because that could be because of your ears, but we want to make sure that it's not from your brain, okay? And if you have the worst headache of your life, you better run to the hospital because that is a sign of a possible aneurysm or a bleed in the brain, okay? So now you know exactly what to do. You know exactly all the symptoms of stroke. So if you have a symptom of stroke, are you going to fall asleep like this lady?
No.
Are you going to say, you know what, I'm just going to take a nap for 2 hours and then I'm going to go whatever, to go for a walk? Or I'm just going to go and drive out to my friend's place. Are you going to do that?
No.
No. Is that the right thing to do? No. So what is a good thing to do if anybody has these symptoms? You have to go to the hospital because that is where the CAT scan and the MRI are to be able to detect a stroke, or the EKG to see if you have atrial fibrillation or AFib, okay? So that is very important. So if we are here and we go out and we see a person having those symptoms, what are we going to do? Call 911. We have to be fast, okay? We have to be fast. And the first thing is that although some of you don't have a medical degree or anything like that, you actually can help. You can help those people. And the only thing that you have to remember is to be fast. Can you say it? Be fast. Be fast. And we're going to see what be fast means, okay? So the first B is balance, okay? The E is eyes. If the person cannot see from one side or the other, that is not good. You have to go to the hospital, okay? If there is any face asymmetry, if one is lifting up and doing a smile and the other one is not, you have to call 911. If the arms, if we lift up our arms and one of them is going down or it's weak, then we need to act fast. Then let's talk about speech. So you tell them, today is a beautiful day in Mattoon. Can you repeat that? Well, actually, you have to tell the person to repeat a sentence, okay? So, or you can say whatever you want to, but the most important thing is to try to understand that this person needs to go to the hospital. And then time actually stands for two things. The first thing is to call 911 as soon as you can and tell them the location or tell them the address, and to look at the time to know when the symptoms began, because that is going to make a difference in the treatment that we can give to these patients, okay? So what do we have to do if we see somebody having a stroke? Be fast. Be fast. And B is for? Oh my God, no. We have to do this better. B is for? Balance. Okay, and E is for? Eyes. And F is for? Face. And A? Arms. S? Feet. And T? Time. And is it time to go to sleep? No. Is it time to go and take a walk? No. So what is time for? Go home. Okay, and call 911. Okay, so you guys are ready for this. So we need to stop stroke. And the way that yes, go ahead.
How fast do you have to get to the hospital? Does an ambulance have anything to help you get to the hospital?
Well, that's a very good question. So you have to go to the hospital as fast as you can. Okay, and I'm going to talk to you.
Fast. I mean, what if you live an hour away from the hospital?
You call the ambulance, and the ambulance may be able to give you medication. So there are some ambulances that are equipped to give the medication that is needed. Some of them. They're usually in the city, but we want to get you as soon as possible. And I'm going to talk to you about the timing to go to the hospital, because that has changed in the past 6 months, okay? So that's why I don't want to talk about a specific time right now, because there's actually no specific time, okay? So first we're going to do prevention for stroke, okay? And that's the last part of our talk. Then therapy, if a person is having a stroke, and you could potentially have significant therapy for this. And then let's say a person is having a stroke, then we need physical therapy to recover, okay? So there used to be said like, oh, in 6 months we're going to know how things are going to go after a stroke. Well, no. It is something that goes lifetime, and you can actually recover 2 years, 5 years after stroke, but you have to work on it, okay? So this is what we're talking about, okay? So time. For some people, if you go within 3 or 4 hours of the stroke, you can get a medication through your veins that can reverse the stroke. You remember that clot that may go to your brain, or that clot that is formed in your brain? Right? We can burst it open. We can dissolve it, okay? So if we can dissolve the clot, that part in your brain that was about to die is not gonna die anymore, right? So would you like something like that? I think that's pretty awesome, all right? Okay, so I'm gonna tell you something more awesome. So if you go and they cannot do that, let's say if you go between 6 and 24 hours of having the stroke, and they cannot do the medication by the veins, they can go through your artery. Have anybody have a cardiac cath? Yeah, right? It's a procedure that they do, and they go through the vessel, through one vessel, and they will go to your heart. Well, in this case, they can go to your brain and get the clot out. Okay? So that's pretty awesome. But the best thing that could happen is that even after 24 hours, they can go and get that clot and try to dissolve it right there. Okay? So the main point is that if you have a stroke symptoms, you go to the hospital, okay? And you have to be fast, because the fastest you go, the more possibility of recovering. Some people can recover fully. Some people may recover 20%. Some people may recover 50%. But if you wait, then the probabilities of recovering are not that good, okay? So this is time, and time is brain. But if you have a stroke and you wake up with the stroke, and you wake up with these symptoms, you go to the hospital no matter what. Okay? It does not matter when the first symptoms started, or if you know the time or not. The most important thing is that you go to the hospital, we check you out, and then we make the decision there. Okay? Yes?
Can they do that procedure at Sarah Bush, going in and getting?
No, they cannot do that. But we can airlift you to Carl, and they will be waiting for you. Well, not for you, but for somebody. Hopefully not. For somebody to get the procedure done, okay? The most important information that you have to have is your symptoms, or the symptoms, And if you know the time where it started, that is good. If you don't, we will take care of it, okay? Okay, so I have this score, and I'm not going to talk a lot about this. This is just how high, moderate, or low your stroke risk can be. But I'm going to talk a little bit more in preventing stroke, because we don't want to have a stroke. And even if you had a stroke, we don't want to have another one, right? Okay, don't go to sleep, fellas. It's almost over. Okay, so we talked about AFib, right? High blood pressure, if you have diabetes, if you have cholesterol, if you have problems with clots in your veins or your arteries, or if you have clots in your carotids or in your vessels in your neck, then everything needs to be in check and tightly controlled. That glucose needs to be really good. The blood pressure needs to be really good. Cholesterol, down. And if you have any circulatory problems, any vessel problems, then you go and check out with the doctor. If you need surgery or if you need any other therapy, they will be able to give it to you. So those are the things that we doctors can help you with, okay? Although no sugar, no cookies, those things are, okay? Then there are things that nobody can help with, okay? What I said, after the age of 55, the stroke risk increases, but who would like the other option? There's no good other option there, okay? We women have more strokes than men, and what they say is that we live more than men, so that's why we have more strokes. Okay? African American or Hispanic and Asian have more probabilities of having a stroke than if you have a family history of if you had a stroke, then the probabilities of you having another one is high, but we can prevent that too. And then if you have any heart condition or a condition of the blood vessels, then that could also affect you, okay? So this is the one that I like. Okay, how can we prevent stroke? Very simple, guys, very simple. Just as everything else with diet and exercise, okay? Yes?
When you exercise, like, if you take like 40 milligrams of baby aspirin and like magnesium and arginine, will that help
What?
that, make it more difficult to have a stroke like that? From exercise?
Well, I mean, it depends on you, and that's why everybody's an individual. So I cannot say that in a general rule, and that's why we're not talking about medications here, okay? Because everybody is different. So what I would say that is good for you may not be good for somebody else, all right? Okay, so diet and good nutrition is vegetables, and meat. If you don't eat meat, it's good vegetables and protein, okay? And exercise, okay? So not only exercise is good for dementia, and I think that you guys have read, that have come to that talk. Exercise is good for dementia, but also it is good for stroke, to prevent stroke. So if you do 30 minutes a day, of walking or moderate exercise, and if you can do a little bit of weight, if you can, that would be the best to prevent strokes, okay? 115 minutes per week, that's all that we ask, and that would prevent strokes a lot, and that would make you feel better in general.
You had 8 prevent strokes on the other page there. How do you prevent AFib? And if you have it, will you always have it all your life? Does it go away?
So if you have AFib, you can have 2 types of AFib. AFib that is continuous and AFib that comes and goes. And that is something that you could potentially not prevent it, although there are treatments. If you go and have a surgery procedure to block that, that could be a treatment. Or you can try it with medication. But the preventing stroke if you have AFib is that you can have medications. So if you form a clot while you're having a fib, that clot can be dissolved. And some of you might be on anticoagulants or something like warfarin or Eliquis, something like that. Okay?
It'll never go away once you have AFib.
Probably not unless you have a surgical procedure. Okay? So exercise, exercise, exercise. I'm almost done. Smoking. Nobody smokes here, right? Nobody. Because smoking increases the risk of stroke. And alcohol, I cannot say, oh, totally stop it. If you take 1 glass of wine a week, that's okay. But if you take it daily, that is not okay. Okay? And then this one is a big one. Do you like soda?
Yeah.
Ah, you like soda, right? Yes. And then you say, like, you know what? You know what? It's not that bad because it's going to be diet soda, right? So it's not going to be that bad. Well, guess what? It is bad. Okay? It is bad because it can increase the risk of stroke by almost three times higher than a person that doesn't drink any soda. Okay? So all those products are not nice because they have sweeteners, and those sweeteners are not very good. Okay? And then the other one, the big one for me, is this one. Okay, I'm not gonna ask if anybody snores here because I don't wanna know. Okay, you keep it to yourself. Okay? But if you snore, I want you to talk to your doctor because that can be a sign of something called sleep apnea. Okay? And the sleep apnea can make you have a stroke 4 times more than the regular population, okay? And it can have you have a heart attack 3 times more. Who wants that? Nobody wants, oh, I'm almost done. Nobody wants that. So if you snore, if you feel that sometimes you choke in your sleep and you wake up with a lot of like, oh, I cannot breathe, you need to talk to your doctor because there is a very simple machine that you attach to yourself when you go to sleep. It's called CPAP or BiPAP. Yes, wow, some people here are very knowledgeable. Or BiPAP, and it can save your life. That simple, okay? So what are we gonna say to soda? No. And if you snore, you talk to your doctor, okay? And thank you very much. The only thing that, before that, the only thing that I want you guys to know is to be fast, okay? Okay, can you repeat it? Be fast? Okay, B is for balance, E is for? F is for? A is for? S is for? And T is for? Okay, you guys have been wonderful. Thank you very much. Okay.